Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. I am here with my now coatless podcasting partner, Dr. Millicent Rovelo. It's a little cold in here, isn't it?
It's a little cold in here. Thank you for having me. I am doing a little bit of I'm too hot, I'm too cold. So I had a coat on and then I took it off. But here we are, and we are here to podcast. And I think we should preface this, that we are in the middle of the LA wildfires. Those started on Tuesday of this week. It is now Friday, so we are still very much in the thick of it. And we kind of went back and forth about whether or not to even record this podcast, because it seems kind of silly to be talking about plastic surgery, when people's homes and offices and livelihoods and lives have been completely upended. But we figured at the end of the day, this is our job and this is part of what we do, so we will continue to do it. But certainly all of our thoughts go out to all of the people that we know, people that you know, that have been massively affected by what's happening.
I mean, my friends' homes have burned to the ground. It is unbelievably sad. And just, interestingly, their attitude is sort of like, yeah, bummer. What could you do? And it is like, what can you do?
What can you do?
We all saw it and couldn't believe how fast the flames engulfed Altadena and the Pacific Palisades.
Right.
And then started up on Sunset. I mean, it is crazy town right now.
It has been very crazy town. And there have been many friends, associates, patients, fellow doctors that have completely lost all of their homes and everything, even their offices and practices. So this is definitely a very strange time for Los Angeles, and we are nowhere out of the woods yet. But I think as a community, as a city, we definitely are coming together and showing each other support, which I think is nice to see. And big shout outs and thank yous to the Southern California firefighters that are doing an incredible job with
Absolutely.
These massive fires.
Yeah, I mean, the first responders have been amazing. One of our nurses was volunteering today out in Altadena, Pasadena area, and they made her the horse vet.
No way.
They're like, these horses all have lacerations, and because they're freaking out,
Yeah.
And all their manes are burned off and everything. So they really needed a lot of horse care. So she's on the phone with the vet and delivering care, and give her a lot of props for being that. Yeah, I mean it's a tough time, but people are still our patients are still showing up. They're having surgery. That their houses didn't burn down, their lives aren't in total disarray. So they want to do their operations. They want to get their stuff done. So we figure we should probably talk about something plastic surgery, and maybe it's just one of those times where it's been on the minds of everybody because it's the middle of winter and everybody's getting laser treatments, that we thought we should kind of clarify, what are lasers, what are microneedlings, what are these energy devices, because there's so much confusion around those things. And we just wanted to, try to kind of bring home what's Morpheus, what's an ablative laser, why is TikTok so hot on CO2 laser now, and those things are all really they're really different, and they have different effects, and you get them for different reasons.
Yeah, absolutely. So this, as we like to call it, is sort of laser season. So that's why we're going to be talking about lasers on today's podcast. And the reason, I'm totally making this up, laser season, as if it's
a thing. It is laser season, though.
I'm coining that phrase, trademarked.
It is.
But the reason I call it laser season is because traditionally you're doing lasers for the quality of your skin, and that has to do, we'll break it down, but the texture and pigment's a big one. And so you have to use some kind of light-based or ablative laser. And all of these lasers really make your skin very sensitive to the sun. So ideally you would do it during a time when you're not going to be exposing your skin to massive amounts of sun, like on vacation or in the summertime or something like that. And usually you get most of your sun damage during those months. So a lot of people go out and do all their holidays and vacations and pool parties, etc. in the summertime, and then they use the wintertime to sort of do penance for all of that damage that they accrued, and then get back out there the following summer.
But there are other devices that people say they're lasers, like the Morpheus device,
and they're not,
and the Cynosure Potenza.
But laser is kind of just, it's a big box, and colloquially people know lasers as something heat applied to your face, but it can contain a whole variety of different things. So I kind of wanted to just break down what all of those were. I feel like I am uniquely qualified to do so today because I also recently just blasted my face. I'm still morphing.
The other day, we got a new laser. It's a replacement, one of our old Alma Lasers. And I should say I am a luminary for Alma Lasers and a consultant for Cynosure Lasers. But one of the boxes finally blew after like 14 years. It was amazing. So we bought a new one, and it looks like this massive droid in the laser room. And so everyone, from our scribe to our front desk gals, they were trying it out on everyone. So everyone was walking around red-faced last week.
Yeah, looking a little special.
Kim, our scribe, came in yesterday to clinic, and she's like, "It looks like I can't get the dirt off my face." I was like, "Well, you got lasered. I mean, that's kind of what it looks like."
That's kind of what it is. So I don't want to do a laser medicine thing because I think that I know you love talking about laser medicine science. I'm going to preempt that right now.
Man.
Because,
okay.
Spoiler alert, no one cares. Outside of doctors and people in the world of medicines that actually do lasers, no one cares.
I'm gonna agree with you on that, because when I start talking about laser medicine, people go like,
their eyes just glaze over. Yeah, it's not pertinent for what we're trying to explain. We're going to talk about indications and the different kinds of quote unquote lasers and devices you can use. So let's start with sort of the most uninvasive, ablative things that we can do. And you got to talk about what you're addressing. Okay, let me back up. You have to know what you're addressing in order to choose the right device for you.
Right.
And I think that's actually critically important because not all lasers do the same thing. So the issues that are most traditionally addressed with any kind of surface heat laser device are going to be pigment. So these are freckles, age spots, dark spots. It can be red spots, broken capillaries, rosacea. Anything pigment related kind of is treated with one kind or a couple different kinds of options. Then there are skin issues related more to the texture of your skin. Do you have fine lines? Is the skin dull? Do you need to exfoliate it, get a fresh layer, a fresh glow? Those are a different kind of laser treatments. And then there are treatments that can address the tightness of your skin. So are you developing early signs of aging? Are you trying to counteract potential future aging? And you want to stimulate collagen and tighten the skin. Those are all three separate concerns that kind of need to be addressed in a separate way. So let's start with options for pigment.
So pigment, there's a lot of ways that people attack it. Probably the most common is with IPL, which is intense pulsed light. And basically what it is you take a normal light bulb, put a lot more energy through it, and it's hit with a flash, and that tends to get rid of like age spots and things on your hands, right. Hands, face, wherever, very easily. And it can require a few treatments. You think about 3 or 4 shots of IPL over 6-9 months or so, and you can get the hands looking good. You can get all these little brown spots off, et cetera. Unlike the red stuff. Like I have poikiloderma on my neck. Everyone's like, what's going on with your neck? Did you have a laser treatment? I'm like, no, it's poikiloderma, and I can't get rid of it. It sucks. It's white people in the sun, bad combo. And we have a laser for that, which I'll do. I'll get to it when I have time. But the other thing you can do for pigment is you can use the PicoSure, which is it's not really a laser. It's actually a really unique treatment that it's a laser, quote unquote, that we use for tattoo removal, and we use it for pigment. And people like to even out their pigment. They don't like this sort of variations and lots of spots and age spots. It does make them look older. And so when they can even it out, it's really nice. And IPL and the PicoSure are sort of the two ways that I think, are the
Get
most
pigment.
effective to handle pigment.
And all of
which
these,
we have both at the Rock
all
Spa.
of these things we're talking about, they all have different names, and there's so many laser companies out there, and so a lot of them will have kind of their own branded name. There's Pico Way, there's PicoSure. There's Pico really refers to the actual specific energy that's being applied, and so that's where it can get to be a little tricky and cumbersome to people. But
It's on my website. I have stuff about all that, and if you go on to the drcalvert.com, there's a section about Rock Spa, which is our Medi Spa, and that's where we have all the explanations of what these things are. But you can always call and get a consultation with one of our nurses or PAs that do the treatments. They're the ones that are doing it all day and all night. I do surgery, and that's why we have the nurses and the PAs to do that stuff, and they are super well versed in these machines.
Yeah, so those are the pigment ones. IPL, also sometimes called photofacial. And then some of the Pico devices, which use a 1064 or a 1540 or like any of the other different wavelengths, address pigment. And most
those are that's the YAG.
That's
laser.
the YAGs. They're the YAGs. So there's so many different options, and that's why I don't really want to get too much into the specific ones.
You kind of need to, but I'm not going to do it.
But you're not.
I'm not going to do it.
You're not going to do it.
Yeah, because there are lasers that you can use for red pigment and for darker pigment. So basically you want somebody doing this for you that does this all the time. Orla.
That's not helpful for these people because they just want to know about it, and they don't have an Orla where they live.
I know they don't.
They just need to know the basics.
But you have to talk to them, and if you have some of the language, you can be dangerous enough to understand whether they know what they're doing.
Yes. So go to someone that does this all the time.
Yes.
And
they don't have an Orla because we have an Orla.
I know. My recommendation would be to go to a facility that is attached to a doctor's office. There are plenty of standalone med spas where you can get away with having your Botox and maybe your fillers, but I think if you were doing any kind of laser work, especially on your face or tattoo removal or anything like this, you really want to go to a provider, whether it's an NP or a PA or a nurse, who is attached to a doctor's office, a dermatologist, a facial plastics, a plastic surgeon, because those are going to be people who I feel really are going to have more of an invested interest in knowing about these lasers, because a practitioner that is not well versed and doing this on a regular basis across a wide variety of facial skin tones can do significant damage if they don't know what they're doing. And so usually when you have a doctor that has a little more direct oversight over a practice, you get a little bit more of a consistent, safe result. So that would be my only thing I would say about the lasers, is just really make sure that you go to a truly verified doctor's office, and whoever does it within the office is fine. But
1,000%
that would
agree.
be my recommendation.
Agree.
And so all of these IPL or photofacial or pigment devices, their downtime is going to be fairly minimal. These are what are called non-ablative lasers. That means that they are not removing any skin. They're just zapping pigment. The pigment rises to the surface. You'll see it as like a big increase in brown spots on your face that then slough off over the next week or so. And so you're a little red for a day or two. The redness goes away, and then over the next week or two, those brown spots fade. If you have a lot of damage, you do have to do a couple of 3, 4, 5, 6 rounds, sometimes spaced about 4 to 6 weeks apart, because with each treatment, you're going to bring a new round of pigment to the skin. And over time, ideally, you get most of the pigment out, and then you transition to doing it once, maybe twice a year, depending on how much sun exposure you get, to just get kind of the maintenance of the pigment. The other thing that you can do is going to be, like you referenced, there's a dye-VL, there's the V-beam. These are going to be for red, capillary-based pigments, really good for patients with rosacea, or like the poikiloderma, like you mentioned on your neck.
Get rid of that.
That's going to be a laser that's very specifically targeted to those areas. Now, the vascular lesions, the vascular lasers, they do cause bruising, and that can stick around for a week or two. So that is not something you want to do before you have any events coming up.
It's like everyone's like, oh, why don't you do that on your neck? I was like, because I don't have 2 weeks to look like somebody,
someone
like
kind
beat
of
me.
Really beat you, strangled you.
Yeah,
so
it does look that way.
The downtime is not uncomfortable. You're not in pain, but you do look like you got beat up a little bit.
Yeah,
so those are the pigment ones.
And poikiloderma is hard to get rid of too. But for those of you who have it, it just shows up, and it's like, what can you do? It's there, and you can make it better. It tends to get better if you stay out of the sun and put a lot of sunblock on and all that, and it gets worse if you Go to the beach. Then you're kind of host. But let's go into ablative lasers.
Ablative lasers.
Because there's all this rage about like CO2. I want a CO2. I want a CO2 because it's all over TikTok or something like that. And, the erbium pixel.
Well, let's talk. Let's just keep it basic.
Okay. Ablative lasers. Fine.
Ablative. An ablative laser, like you referenced earlier, means that you are actually taking a layer of skin off of the face or the neck or the chest or whatever you're treating. And that is where you're actually going to see a lot more downtime because your skin is literally going to slough off like a snake shedding its skin. And you're going to see various levels of intensity. So all the different lasers that we are going to reference here have different depths of intensity. And the deeper it goes, the more intense it's going to be, the bigger a result you're going to see, but the longer downtime you're going to have.
Yeah, and the ablative lasers are, they're great because they refresh the skin. The skin looks amazing.
Yeah, it's smooth. It's resurfaced. The fine lines are improved. The coarse texture can help smokers' lines, those fine lines above the lip. CO2, like you were referencing, has always been held up as the, quote, gold standard of ablative lasers because historically, and even still, it is the most intense. Back in the day, a long time ago, we're not going to spend much time on it, they were incredibly intense because they actually took off the entire surface of your face. Then we moved to fractional CO2 lasers, which made very controlled micro CO2 injuries that left some intact skin behind, and that really improved the overall recovery, shortened the recovery time, and had less side effects while still providing a really good result. So now I would say fractional CO2 is sort of the gold standard for what an ablative laser can do. And everything else out there will get close to it, but usually you have to do it for several more sessions with less downtime, but more sessions required to get to that one CO2 result.
Yeah, I mean, CO2 it's good. So back when I was like going through medical school in early time in my residency, you'd see people that would have a line of demarcation on their mandible from a CO2 laser.
On their jaw.
And it really caused hypopigmentation of the areas that were treated. I saw a ton of this.
Hypopigmentation means you don't have any pigment in your skin. I'm trying to define our terms here.
Thank you. You're going to have to I know, just direct traffic here a little bit for me, but because I'm like on a roll with this. I mean, I love laser medicine.
I know.
I do. I love it. And I think that you can't be, if you're doing facelifts and all these rejuvenation procedures that I'm doing and you're doing, you have to have this as part of your practice because, you spend the money on the facelift, but you got to keep the skin up. You do. Otherwise it's like, you're missing a big opportunity to look awesome, and that's what people want. And there is a big opportunity to slough that skin and take care of like basal cell cancers and squamous cells.
We're not saying that is the treatment for cancers.
It's not.
That is not the treatment for cancer.
But it has been shown that there are reduced rates in people who get peels and in ablative lasers because it reduces, it turns over the skin, and if you've got stuff brewing, like you're toasting it. So it's a good thing.
Or those people just stay away from the sun because they care about their skin.
Maybe that's what it is. That may be the issue. It's hard to know. But I love the fractionated erbium. So there were two, like as a resident, we didn't have pixelated anything. Everything was a spot. And like the CO2 was a very fancy spot thing. And then the erbium was just like a straight old circle spot. And erbium was much safer. Like you didn't get hypopigmentation, you did get the resurfacing, you did get all the benefits, but you had to do it more frequently.
It doesn't go as deep.
It doesn't go as deep. Yeah. The depth of penetration of the erbium, I think, was something like 480 nanometers, whereas the CO2 was like 1,100 or something. It was like double basically. So you were treating more of into the dermis. But you were also getting, more injury to the pigment-bearing cells, and so there was a, and don't quote me on those numbers. I think they're right, but I don't have them in front of me. So, yeah. But basically, it was a deeper treatment with the CO2 than the erbium. But they both are ablative, and they both do really nice things for the skin. I liked the erbium because I thought it was safer, and I just remember playing golf with this one woman. It was like me and my father-in-law were going to play golf, and they paired us with this couple, and the wife just had this like incredible line of demarcation. And she asked me about it because I was a plastic surgery resident. And she's like, what can I do about that? I was like, kind of nothing. You know,
Right.
it's sort of like a very permanent thing. Now, again, with the pixelation, that's not really as common.
It's nowhere near as common.
Yeah, it doesn't happen like that anymore. So CO2 is great. I'm not bagging on CO2. I like it. I do it. You know, one of my friends had me laser his whole face with the CO2, and he was red for 2 weeks.
CO2 is great. So CO2, everything now CO2 is fractionated. You can dial it up, dial it down. You can do a very light dusting of CO2 and have a much less intense recovery. So the technology has just come a long way. And I think that if you are talking about doing any kind of a little bit deeper skin resurfacing, you have to talk about addressing the neck. Otherwise, you definitely are going to have some step-offs and demarcation. So you can't ignore the neck and the chest, especially in ladies, the décolletage area. If that's all brown and pigmented and coarse looking, but then like you have this really smooth face, like it's just, you got to treat the whole area to have some continuity for it. And the CO2 lasers, if you do them, it's usually one treatment, maybe two if the pigment issues are really bad, but usually one treatment, and you're going to be red, you're going to be swollen, the skin's going to slough for about a week, 10 days, and then you can kind of reemerge and look all beautiful and glowy. But plan on a little bit of downtime. So these are the lasers that sometimes people like to include with facelifts because they're already down with the facelift downtime, and this is a great time to add on that CO2 laser.
And I don't love that. So I'm just going to go on record. I do it because everyone's like, oh, you should do it, you should do it. And you get burns from that. You get problems. I don't love it. You can't turn it up as much. Yeah. I would prefer, for my patients that are going to call me and say, I want to get my facelift done now, I would prefer to do a pre-treatment, maybe 6 weeks before, and then a post-treatment, maybe 6 to 8 weeks after.
If you need it.
Yeah, because, I mean, you pretty much do if you're having a facelift. But at the same time, I don't love doing it when they're in the operating room because I've elevated the skin. The blood supply is not as great. It's just not my favorite. I understand that you can, and I do. And I typically will do erbium, though. But, like, somebody asked for a CO2 recently, and we did it, and, you know, she got a little burn at the edge of the flap. And it's like...
I've definitely...
Do we need that?
I've definitely seen that. So that's the CO2s. The erbiums, like we've been discussing, erbiums, pixels, these are the ones that you're going to do that are ablative. But typically, if you're just starting out, you need about 4 to 6 treatments, again, about 6 weeks apart, to really see the final result that you may get with 1 or 2 CO2 lasers. But the downtime is substantially less. You will still look red. You'll look like, you know, our scribe Kim did, a little red, a little brown sometimes if the pigment's coming up. And then the skin sloughs off for about a week. And it's annoying and it's a pain. But you can still go about and do your daily things, just looking a little bit reptilian.
But then it does look great.
But then it looks great.
It looks great.
It looks great. And you do your package of 4, 6, however many you need. And then kind of like with the IPL, you maintain it 1 or 2 times a year. I like doing both of those together. So the IPL, like we talked about, or the photofacial, gets rid of the pigment. The erbium or CO2 will get rid of the coarse skin, the fine lines, the wrinkles. But you can combine them to get synergy. And the CO2s and lasers will get rid of pigment too. That's just not exactly what they're specifically designed to do. But if you did that on its own, you would see significant improvement in the pigment as well. But if you really want to hit all aspects of facial rejuvenation, you can do them in combination. A photofacial or IPL combined with an ablative laser like an erbium. And that is a fantastic combo. I love doing those together because you really hit all of the issues at once.
Yeah, and you're not bashful about getting in there to do those. You're really good about it.
I'm on the like once a year track right now, and I'm pretty good about making sure I do them to the point where like pigment doesn't even really come up anymore. I was like, where are all the brown spots? I don't have them anymore. But then the other thing you have to be really good about is staying out of the sun. Like I've gone like full like sun shield in my car now. Like I have those like, you know, Star Wars visors that I wear over my face when I'm driving in the car. Because especially here in Southern California, even in the middle of winter, the sun is intense and it's hitting your face and it can cause damage. So
you should just go to the next level. Just get like a whole stormtrooper mask.
Yes. Oh my gosh.
What happened? I had lasers. Stormtrooper costume again. It's good.
Oh no, I just wear it all the time. Sun protection. So those are the sort of ablative pigment combinations that you can, and I would highly recommend that you do. Then there is a different category that people like to throw into the mix, and these are going to be sort of the skin tightening devices, which are not lasers at all.
No.
But people call them lasers. They say they get zapped. They kind of throw it in the bucket. But these are going to be sort of your radio frequency, your RF microneedlings, such as Morpheus. That's sort of the brand name that everybody knows.
Yeah, but there's Morpheus and Potenza.
And Potenza.
They're two different companies, two different devices, and I think they do two different things.
There's another brand out there too that people are using a lot. I'm blanking on the name, but there's several of them out there, and they all use RF, so radio frequency. And what this is basic microneedling. Microneedling is a little pen. Basic microneedling is this little pen that has needles that come out real quickly, and they make these micro injuries in your skin. And you run it over the surface of your skin. You create these little injuries, and then as the skin repairs those injuries, it builds collagen and at least is sort of a smoother and hopefully over time kind of tighter appearance to the skin. And it's a really good maintenance thing to do. You can do it as frequently as every 2 to 3 months if you wanted to. So every quarter you go in, get some microneedling. It's just a good maintenance thing to do for your skin to keep it glowy and healthy and keep those collagen fibers rejuvenated. If you take those microneedling needles and then you add radio frequency energy to them, you really dial up their efficiency.
Now you're talking.
So the Morpheus pins or any of these Potenza devices, the needles go much deeper, so they're going 2-3 times as deep as a typical microneedling needle can. And as the needles penetrate into the skin and the dermis, you're getting a blast of the radio frequency energy. Like zzz. So you're getting not only actual mechanical injury, you're getting a heat injury. And so that doubles sort of the work the skin has to do and the collagen that needs to be produced to repair these injuries. So the idea is to provide tightening and collagen building over time. Again, several doses of the Morpheus. They usually recommend 3. And I keep saying Morpheus, but it's really any of these RF technologies. 3 at a time, spaced about 6 weeks apart, and then transition to your 1 to 2 a year.
Yeah, Morpheus is more for tightening. It's like trying to mimic a facelift. So
Sure.
by doing a Morpheus, you're trying to get a little tightening through here. And I will tell you that my patients who've had Morpheus are happy with it. They've all come back and sort of said, well, it's not a facelift, but it did make a difference. It did tighten things up. So as long as you understand, you're not going to get your platysmal bands taken care of. You're not going to get your jowls gone, but you're going to make them better. It's good. The Potenza, which also does tightening, is more of a skin tightening radio frequency microneedling because it's more superficial in terms of where the needles go, but it has a unique tip called the fusion tip, which you can infuse like exosomes or vitamin C while you're doing the microneedling and radio frequency. So I think that's pretty cool.
That is pretty cool.
And you can do both, space 6 weeks apart or whatever. But I think like if I were to do, like if I had the time to do it, I would do probably a Morpheus, then a Potenza, then a Morpheus, then a Potenza, and see, what that gets me. Because I think it would get me a lot of the resurfacing benefits from the microneedling, but I'd also get the tightening from the Morpheus. So I think you can look at these things, however, you have to kind of tell your practitioner
what you want,
what's bugging you, and then you can kind of, if they have excellent command of these devices, you can do a lot with them. And I think it's great because it's not surgery. You don't have to take the 2 weeks off. It's not oodles of tens of thousands of dollars. It is in the thousands of dollars. And it's, the cost of these things are typically $1,000 to $1,500 for a treatment, depending on how you couple it and how many you do, et cetera. Yeah. And your downtime is anywhere from, a day or 2 to a week, maybe 2 weeks with the CO2 ablative. But, you can kind of get this stuff done and go about your business and look great while you're doing it.
Yeah, the Morpheus downtime, you're going to be red for the first night, and the next day you'll be a little red. But then after that, there's really no downtime to the Morpheus. There's no sloughing of the skin. There's really no pigment changes. It's more changes that you're going to see over the course of about 4 to 6 months. So the downtime to the Morpheus isn't bad. And I would say that you really have, like we talked about before with all of these devices, go to someone who really knows what they're doing, because there are going to be issues that arise with different patients, because not everyone is a perfect, Fitzpatrick type 2, fair skin, no issues, and you can just do whatever you want to them. Because if you have any kind of skin issues, you really have to adjust the different kind of treatments that you're doing. We talk about skin types, Fitzpatrick skin types. The most fairest, think about like an Irish maiden is going to be like a 0, and then go all the way to the darkest person, they're going to be a 6. And everything in between then is 2, 3, 4, 5. And so a lot of these lasers, especially in IPL or photofacial, can't be done on anybody that's more than about a Fitzpatrick 4. And that's going to be a lot of the Hispanic population. Anything darker than that isn't really a candidate for it, except for some of the Pico devices. And so Picos are good for the darker skin tones. These are nuts and bolts kind of things, but you need to go to people and providers that know this kind of stuff. If you have any issues with melasma, so melasma is a different kind of pigment issue, not really necessarily related to age spots, although the sun does make it worse. Sometimes you can't do light-based treatment like an IPL or a photofacial because it'll make it worse. And so you have to do something along the microneedling, maybe with a vitamin C or a peel or one of these light erbiums. That's a different way of treating pigment. And then if you're like me and you have super sensitive skin or rosacea, you have to treat it with kid gloves. You can't go too deep. You can't go too strong. You certainly can't put any vitamin C's on right after you do any kind of microneedling treatments. Like, you really just have to know what the skin problem is that you're treating and have someone know your kind of skin and what it needs. Like, this is not by any means a one-size-fits-all.
No, and that's why I do harp on the laser medicine so much, because I don't see how, as a practitioner, at some of these, franchised, box at the mall kind of, laser places. They hire people that don't know what they're doing. They say, if they look like this, these are the settings. If they look like this, these are and that's not true. You have to understand laser medicine to make this work.
And you have to know skin. You have to know about all of these skin issues we just talked about. You have to be alert for potential skin cancers. You have to know, like, what's your family history? You come to me and you look like you're pretty fair, but maybe you have like Hispanic heritage and you actually are going to be much darker than the average maybe Fitzpatrick 3 looks like. So these are all things that someone who does this all the time will know to ask and know how to treat. You just got to make sure you get to that person.
I like it.
Yes.
I think that was a good summary, and I didn't get off track on you.
I don't think my eyes glazed over once.
But for a full explanation of laser medicine, we'll be doing a supplementary podcast. That'll just be me with Millicent sleeping for most of the time. And you can tune into that if you want to.
Yes.
All right. Well, I think that's it for this one. And, again, just our prayers for everyone who's suffering during these fires. And just a big thank you to the first responders, the firemen and women and everyone who's doing what they need to do to get this under control. We really hope that LA can recover from all this as fast as possible, but it's going to be some time, that's for sure. Yeah. It's being here, seeing it with your own eyes is really tough.
Yeah.
And in the meantime, too, if you're still going about your business, we're here for you. Come on in. We'll get you fixed up. We'll explain the laser medicine, and you'll get yourself a treatment that fits you. Sound good?
Sounds great.
Then this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.